All right. I know Izzy's already said her welcome, but I also wanted to say hello to everyone. Bridget, it's nice to see you here. And Anusia, I'm glad to see you in here as well. Anusia joined us for our book club discussion earlier. I guess that was last week. It was a really good conversation. And Tim and Chandra sounds like. So great. Welcome, everyone. So glad you're here.
Fantastic. All right. Well, welcome to session 3 of Rewire Your Brain. So, in today's session, we're really talking about how to look at that process and discover what's going to work for you. And here we'll be looking at not only the lifestyle, the biological, neurological, but we'll also be looking at therapies. And Sherry's put together a beautiful map of that so that we can look at what that process would look like for you. And in this process, there is a path of continuous refinement as we move through this and talk about this today. And just in a general sense, we'll start with step one of knowing your starting point. Step two, knowing what's missing and being able to identify a roundabout area of what's missing. And then we'll look at how you to research and apply those interventions and then reevaluate and refine them. So
Yeah, and
before,
if I can just jump in here, Izzy, the prior 2 weeks has been giving you the fundamentals and that foundational information so that you can then take that and understand these next 2 weeks of what we're talking about. And as Izzy said, this is a very iterative process. So you're going to start with some information, you're going to find out what's missing, and as she said, then you're going to go research, you're going to apply it, and then you're going to say, you're going to notice that you've missed some other stuff, or that those therapies maybe didn't work, or it did work for one symptom, but not the next. And so now we have to go to the next step. So I do think it's really important to emphasize that it's an iterative process because you don't want to get frustrated along the way and think that you've reached the finish line when you're just sort of midway through.
yeah. Yeah, and we purposely put not just this continuous circle, but to the spiral here, because it feels like you're getting closer and closer to the answers the more and more you do this iterative process.
Yeah, that's a good point.
And for those just joining, this presentation is recorded, which you might have gotten that notification. Replays are available within the course portal, so you'll need to go in and sign up for that separately to be able to access. Now, that's extremely important, especially for this session, because we will have workbooks, several workbooks that we'll be referencing here. And a few of those are already available within the portal if you'd like to access them from there. And then we'll have a couple more being added as well. And
And,
then
and
we
I did want to note here too that we've got homework, so pay attention today. And as Izzy said, you will, if you want to participate actively in week 4, you're going to need the information that we're going to share on the portal today, so you can do a little bit of prep work. Don't worry, nobody's going to grade you on it.
Yes,
I see you got the poll up,
and I
Izzy.
just launched the poll, so go ahead and take a moment. We haven't got to do this in our previous sessions yet, so we want to get a little bit of an understanding of where you're currently at within your neuroplasticity knowledge as we deep dive into this even more today, just to get a good sense of where you are now, and then as we finish session 4 next week, we'd love to see where you're at there too. And this just helps us, as we're creating more content and more trainings, to know where the majority of our audience is and what information that we can bring to you as well. So thank you for taking the time to do that. I'll give it about 20 more seconds. Welcome everyone who's just joining. And so again, making sure that you access the portal so that you have access to these workbook pages. There's several different ones that will be in that portal so that you can do these exercises. This is a very active activity that we're going to be doing today and next week, because in order to make change, we have to take action. All right, so we'll go ahead and end that poll. Thank you. And then we're always going to have our disclaimer, which is just to say, really, we want you to take this knowledge and share it with your care team to make a plan. And we'll be diving into that even more on session 4 next week, talking about how to be your own advocate and how to work with your care team with this information as well. So we're going to break this down into steps. We've worked to try to make this as easy to follow as possible. But if you have any questions, please put those in the chat as we move forward. And
And
Sherry?
Izzy, just to kind of just overview on the steps, right? Our information today is give you the information you need to know for your to determine where you're starting from, what's missing, so that we can get to what everybody wants to get to, which is which therapies am I going to need? But you got to understand this before you can get to that point. So just an overview of the process.
Yes. Yeah, and so we look at step 1 is evaluate. So we're going to be looking at these 3 categories to see what knowledge we have of and what we're currently doing within these 3 categories. And as we've done our pyramid over the past couple of weeks, really having that knowledge is first, but then having the lifestyle changes. And here we're starting to get into a little bit more deeper of the lifestyle changes of having your blood work, knowing what testing you've done. So we've got to really collect that data and know where we're starting from. And then we'll move into step 2 here in a moment. So some
And
of the work, okay.
oh, sorry, Izzy. Yeah, the lifestyle component of this, if you've heard anybody and any of the researchers or advocates out there talk about neuroplasticity, this lifestyle piece is the number one thing
Huge.
you can do on your own. It is the most effective. And so it's simple in its overall approach, but knowing where you are and where you want to get to is key to that. And so we always start with lifestyle and we put a lot of emphasis on that, even though the external work is going to be sort of the biological stuff and the neurological testing. That lifestyle component is the most important and the biggest bang by far, especially for the buck.
For sure. And some of you all may have heard some of these things. Maybe you've heard some of these things, but you didn't notice the weight that it carries along with it in your recovery process and neuroplasticity being applied. And all of us might be at different stages of this knowledge journey as well. So if you have heard this, fantastic. Start really looking at how much are you really applying it to your life and where you can improve. And if you haven't heard it, then continue to hear it, continue to process it, because the more you hear it, the more you'll understand it and remember it. All right, so some of these workbooks that we'll be utilizing today, and just a reminder again, those are in the portal. And then anyone coming in, just make sure you're on mute. Perfect. All right, so lifestyle. We covered this a little bit last week. But just a review of these core areas, so nutrition, exercise, sleep, stress management. Stress is definitely going to have a huge impact on your cognitive abilities. And then stimulation, making sure that you're challenging yourself. And detox, meaning is there toxins in your life? And that can be a multitude of different ways. Supplements and maybe some pharma. And then we're going to keep mentioning nutrition and exercise because those are having huge impacts. And when we get into the lifestyle workbook, just giving you an overview of the different sections that are in here. So exercise, meaning move the body, which is going to boost the brain. Emotional and stress management, so that inner peace. And as we mentioned last week, there is a chemical component of emotions, and stress is creating chemicals in the body and having an effect on the brain. And then that mental stimulation, but also social interaction. So those are both stimulating the brain. Sleep, toxins, and nutrition. And so we're going to go into a little exercise. We still got a few people joining. There we go. So we're going to go into a quick exercise, and in this exercise we're going to utilize the chat, so make sure you've got your keyboards ready as we get going. And so I really want you to think about these things and let's have a chat conversation going. So, number one, with sleep, what are your biggest daily stressors and how are you coping with those strategies? And I think I might have done stress. I think this is the stress workbook page. But so we'll look at the stress. And so, what are your biggest daily stressors? And how are you coping with those? Right? Society typically pushes on us with marketing, right? To go binge eat, to go drinking, to do a lot of things to cope with our stressors, but there's a lot of really great healthy ways as well. So it might be meditation, it might be going for a walk, as we've showed time and time again. Those walks, especially in nature, have a huge impact on our health. 45 minutes 3 times a week is showing to have a huge impact. Right? Exercise does really help, yes. All right. And then number two is, do you practice relaxation techniques like deep breathing or meditation? And these are two huge ones that really do help. And so how often do you make time for this? And then when we look at our bedtime routine, do we have a bedtime routine? And there are factors that can help you get to sleep, like 1 hour before bed, have no artificial light in front of your face. So put the phones away. We even have, me and my little one, we have a red light style book lamp. So that way it doesn't stimulate any of that. And it's fun. We get to toss the book lamp back and forth to each other as we're reading before bed. And we do little things like putting lavender essential oils in the diffuser, and we might do some lotion and a little massage before we go to bed. So there's lots of things that you can do to help yourself decompress, as well as these big belly breaths.
Yeah, I love all of the recommendations that are coming in here, and people are definitely thinking about it, which is good. I love seeing that
Yes.
it's on your mind and you're conscious of it and really thinking through what to do there. And it is a very, very personal
Hmm.
habit that you have to do because Izzy, you have Willow that you have to
Yep.
incorporate into yours, right? I incorporate my dog into mine, getting him ready to go to
Right?
bed.
And who you have
Uh,
in your life is going to make an impact. And I don't think he would mind me sharing, but my dad has been asking me a lot lately. He was like, I'm having a really hard time going to sleep and staying asleep. And so I started asking him what his bedtime routines was, and he was like, "Well, I have to have the TV on in order to go to sleep, and I have to have it playing all night long." And I was like, "Well, scientifically, right? Like that is something that is going to stimulate the brain to keep you awake. So you might need to shift that habit and that dependency." And then we looked at what supplements he was taking, and he was actually taking one called ashwagandha. It's popular nowadays. And depending on the person, it can stimulate you or it can relax you. And I was like, maybe you shouldn't be taking that right next to bed. So looking at what's going on, what those routines are, and really taking a moment to look at that.
And
All right.
we intentionally wanted to highlight sleep here because if you don't get deep rest, none of the other stuff really works well, quite frankly, right?
Right.
You can have your exercise, you and nutrition, and those are very key things, removing toxins. But sleep has a very special role because it helps your brain recover. It helps cement those memories. Autophagy takes place at night, which is cleaning your cells, getting rid of the dead cells so that your body can recover and repair. So, outside of exercise, I would say sleep is probably the second, if not those two, on par of most important things. And if you're stressed, you can't sleep well. So you have to look at all those factors, but do take special attention to your sleep. I think and you will see a tremendous payback very quickly, very quickly.
For sure. And it's one of those things that maybe you don't notice it right away. If you have a lack of sleep, you might not notice it right away, but it might accumulate over time. So I say that meaning it can affect each one of us differently. Maybe you're that person that's like, I don't need a whole lot of sleep, but you're having effects elsewhere. It might be time to take a look at that. And so we won't deep dive into each one of those sections for time's sake this evening, but the point here is in step one, we want to look at it. At step two, we want to identify what's missing. So as you go through this lifestyle workbook and you identify your areas of strength, you identify the areas of weakness and ways that you can improve, we recommend not trying to improve everything all at the same time. That generally does not work very well. But to pick one area that feels the easiest to make some improvement on and start there. We want to give ourselves small wins as we're making behavior changes. And then slowly go through it and begin to make this a beautiful self development journey and health journey in the process. You'll see things start to shift in your life with those.
Yeah, and like you said, Izzy, celebrate the wins. I would encourage everybody not to. I think even in the workbook we talk about do one a week, right? Try
Yeah,
a new one a week. And the more I think about that, perhaps that maybe is a little too aggressive, right? Because
depends
it
on the
takes
person.
three. Yeah, it depends on the person. It may take up to 3 weeks to establish a new habit. And if it's something like sleep, which is very habitual process,
Mm-hmm.
that is probably going to take a little bit more time. So do what feels right and what works for you. And I do encourage you to take a look at that sleep one first if that's an area where you think there's room for improvement.
Definitely. I know that's something that's been on my mind a lot, is improving our sleep routine because it's not always consistent, right? Like we might have some good habits, but starting to realize that, oh, maybe we're only doing that 3 days a week and not seven, right? So it might be different areas in how you examine that. All right. In that step one, our next area is the biological factors. So again, workbook will be the biological self-discovery workbook. And Sherry, I'm going to let you take this one.
Yeah, I think the important part of this discussion, as well as the neurological factors workbook that we're going to talk about, is there are all of these relevant factors you need to consider what is right for you. And it is very, very issue dependent. I spoke with an individual earlier this week who had, she called me about her mother. Her mother had had a stroke and was having memory issues, right? And off the top of if you just look at that at face value, you would think, okay, is she developing some dementia from that? But no, I went back and looked at her neurological reports, and it was clear she was still having so much inflammation. And that was causing more than likely the memory issues that she was having because the damage in the brain was not long-term memory areas. So you have to really know your data to understand which biological factors to look at and which biological factors might feed the neurological component. So again, back to this iterative process. But I want to just cover at a high level what those key factors are, and you'll have to take a look at this for yourself and go through them and see what makes sense. Know, figure out what you know already. What does your blood work panel say? And most of these biological factors, you will gather that data through your blood work and relevant environmental testing. So understand your inflammation, your C-reactive protein, CRP under markers, and your cytokines, homocysteine. These are your key factors for that. Things that cause inflammation can be viruses, can be gut microbiome issues. If you've got a TBI, it could be inflammation because of an injury. You could also just have an ongoing area of inflammation from an injury or something like that that you're not haven't treated, such as a fractured bone. You may not know that you have a fractured bone, but that may be causing that, or a wound, for example. So inflammation and infections. By bar none, that is probably one of the key issues to address because it affects your cognition so much, and it has a downdraft impact on everything else. So it's very difficult to control your hormones, for example, and really get the benefit of your nutrients in its full capacity if the inflammation is out of control. So if you're not just a female, but a male and you're having some hormone issues and changes, so for example, I mean, it seems pretty obvious for a female if you're going through menopause, but there are studies coming out now that wearing polyester, being having exposure to microplastics really affects that testosterone level in men specifically. And that then drives so many other things in your body. So if you are experiencing some of these issues, take a look at your hormones. And you'll get that through a basic panel as well. You just have to ask for it. None of that is going to be difficult to get. Your nutrients, your basic blood panel work should get that for you. Many people have issues with B vitamins, absorbing those. So you want to take a look at that, where almost everyone is deficient in vitamin D and the omega 3s and fatty acids. Those are almost always out of balance for everybody, it seems. Next slide, Izzy.
Yeah, and and magnesium too, right?
Yeah.
And depending on your condition, there are many conditions where it will deplete your B vitamins, zinc, magnesium, all of that faster as well.
Yeah, good point. Insulin resistance, there's so much out there now about insulin resistance that also affects your inflammation. It is a contributor to Alzheimer's significantly. So you need to know what your fasting glucose level is and your hemoglobin A1C. That's the long-term marker for what your insulin levels are. Toxins, exposure to heavy metals, VOCs, and mycotoxins. And I want to talk about this just for just a moment because I don't have on this slide, but we need to add the microplastics onto this because there's so much research coming out now as to how that triggers your inflammation rates. It affects your hormone levels specifically, and it can cause genetic malfunction. So you want to include that. Heavy metals, mercury, lead, this can often be due to the pipes in your house, the water exposure to that. VOCs, that primarily is plastics. So it can be from fuel, dry cleaning, chemicals, cleaning chemicals that you use in your household, and mycotoxins, which is they're basically mold. So we've all heard of black mold, but there are other molds, and depending on your unique chemical makeup, it may be playing a much bigger role than what you would genuinely anticipate. And usually, when there's a little bit of mold, that's only on the surface. It's back to the iceberg analogy. If you see a little bit, there's usually a lot more behind the scenes, hidden behind the walls, etc. And the last piece here is your genetics. So APOE4 is the marker, the genetic alleles that you have that are correlated with Alzheimer's. If you have those, it doesn't mean you're going to get Alzheimer's. It means that your risk is much, much higher. MTHFR is your inability to methylate and process B vitamins, so that affects your energy level, and that is surprisingly high. About 40% of the population in the United States has a dysfunction with that gene. And if you've got fatigue issues, I would say that's something you really need to evaluate. And there are a couple of others here which are explained in the workbook. And I want to just go back and touch on this insulin resistance just a few minutes because it not only causes damage in your cognition, but it really shrinks your brain. So your body loves ketones, and if you're feeding it sugar, which is high, which causes the insulin resistance, it's not getting the fuel that it needs, and it can't work to remove those dead cells, the senescence, that autophagy, and it really sends your body into inflammation. And the first rule of anybody who's been diagnosed with Alzheimer's or cognition or almost and cancer is to get rid of the sugar because
Hmm.
of this issue and the inflammation that it creates. So, I think that that's a huge one, quite frankly, that I,
Yeah, well, and to piggyback on that, right? Like metformin shown to be a longevity. It's being thought of more and more as a longevity um, supplement. Just I guess would be a great word for that. But um, and that's to really help with the sugar. And so if we can decrease the sugar in that way, and it's again, I'll just side note, like that's shown for people who do have high sugar, that it's helping the longevity of those people. And I think it was like an extra 10 years on average
yeah,
for
it's
lifespan.
yeah, they are including that and they're looking at it as a cognitive enhancement supplement. But the reason it's a cognitive
It's
enhancement
because of the
supplement
sugar.
is the sugar. Yeah.
Right. And so I
So
was like, it's kind of another way to just say how much that makes an impact.
yeah. So, when you think about what level of test that you need, and I put an image in the workbook here, this is also an iterative process, right? So, if you go to Dale Bredesen's website called Apollo Health, he has a list. It's in his books, and there are most functional doctors now will recommend a basic set of labs and blood work that you do. It is going to be more extensive than what a general practitioner would ask for. So when I say it's basic, it's more rigorous than what you get there. But I would say start with the base level that he recommends, Dale Bredesen, and go from there. You do that testing and then you put in try a therapy and it didn't work. Then you want to go back and look at your testing again and see what else did I not do, because the testing can get very, very expensive. uh, this base test, and where depending on where you start, is anywhere from $800 to $3,000. It can go higher. And I will give you my experience was around $5,000 for when I first started this process for myself, because I was having some significant cognitive issues. Turned out to be hormones, turned out to be my thyroid. And once I got that into balance, my cognition returned. But I was worried about mold, so I went ahead and did the mold test because my house had flooded previously. So when you think about what tests you need to not only think about your the base levels that are recommended, but what in your personal experience from a hereditary standpoint or from a environmental standpoint needs to be factored into that, which can cause the cost and the initial level of testing to go up.
Yeah,
So
and I
work
would
with
say
your physician on this. Oh, sorry, Izzy. The last thing I'll say
mhm.
here is work with your physician and make sure they understand why you want these certain tests. Because if your doctor orders them, 9 times out of 10, they will be covered insurance, but you have to get your doctor to agree to order them, and he has to have justification or she needs justification for that. So you have to do a little bit of that self advocacy here to know why you want those tests so that your physician will order them for you and you can get them covered by insurance.
Yeah, and I'd say there's some really cool new programs. Sometimes there's a naturopathic doctor that can do those and advocate on your behalf, and they might look at the percentages a little bit differently, or the numbers on some of those a little bit differently than the standard doctors do, just because vitamin D levels can be looked at, the number can be different depending on different offices that look at it too.
Yeah, so you're talking about the standard level
Yes, the
of
standard
the
level.
results.
Yes.
Yeah, and that's a great point, Izzy, because there were standard levels that were set, and the majority of these levels for all of these criteria or all of these individual elements that you're testing was set way back in, I think I want to say it was like the 50s and 60s when they set most of those standards. They didn't include women when they were setting those standards. They only tested a very small age range population when they set those standards. So I would give the functional medicine organizations out there credit for helping us understand that we really need to say, okay, that was the average, but that was the average that was set for a very small population, and the range is really much wider.
Yes.
So, yeah, it's a good point. You really do want to discuss that with your physician and why you think you should take a different perspective or standard into consideration. Thyroid, for example, is a big one that is
Hmm.
completely changed. It's completely changed on what that expectation should be, even since 5 years ago.
Yep.
So,
Perfect. And as we get to the step two on this portion, identifying what's missing, right? Like, have we looked at the inflammation and infections, hormones, nutrients, insulin, toxins, genetics? Are there any testing that maybe you haven't done that might give some more insight so that when we move to step three and we're looking at which treatments that we've eliminated any of the factors that might be hindering some health issues or health recoveries.
yeah, I would say go into the Apollo Health website, pull down that list of what the recommended test, take a look at it, go to your physician, ask for the blood workups that you've had, print them out, sit down, compare them side by side, see what's missing, and then think through what else you want to go do and how old. We didn't talk about that, the age of that testing, right? How old has
Mhm.
that been? How long ago was that been? Is it still relevant? Typically, for most of these things, you want to test annually. Some of it can be every 2 to 3 years, depending. Some of it needs to be every 3 to 6 months as you're trying to modify your levels or medication or exposure. You want to know if what you're trying is being effective. So when you're in the process, it'll be much more frequent. But once you get to a maintenance stage, it's typically annually.
All right. And as we get into neurological, we do have a neurological workbook for this section as well. And as we get into neuroimaging, there's some common ones, but there's also the specialized ones as well. So different imaging devices are going to be able to look at different layers and depth. They might be able to see different fluids. So these are going to vary in what they're able to see and the connections of what they're seeing. And Sherry, do you
Yeah,
have?
on these, so you will have to advocate in general for these specialized scans. They are expensive, so you need to understand what's missing. Talk to your doctor about that. And the way to do that is if you go in to read the report, right? So you probably don't have the skill set to read the image itself, right? But the report is often very detailed. And when you read that report, you think through it and say, well, what's the root cause of this particular issue? Is Does the imaging and testing I have help answer that question? If the answer is no, then which of these tests would help us get that answer? And if we get the answer, how might that change the therapy or the intervention or what I want to go do? And
Mhm.
so it will take a little bit of research to do that and having those conversations, but you will have to advocate for that. So in the example I talked about earlier, which was an individual who came to me about her mom, we were looking at what that neuroimaging was and how the brain had changed over time and why that inflammation was still there. And there was a shunt put in place for fluid drainage. And it looked like it was continuing to cause some damage in her brain, the shunt itself, because there was brain atrophy around that area. And so we talked about, okay, what do you need to do to get an answer to whether the shunt is causing that, whether the brain damage was causing that, and what might the next steps be to address that. And so we walked through some of these examples and selected a couple that she needed to go back and talk to the neurologist about to see if it was worth doing that, or if it was we just needed a more updated version of the CT scan that she had
Mhm.
done.
Yeah, and these specialized tests listed here, like each one of those are going to give an even deeper insight into what's going on. So the SPECT, for example, it's commonly used for ADHD, depression, PTSD, Alzheimer's, traumatic brain injury, and it's going to give a snapshot of the different brain regions and how they're communicating. And so that might not be a common test that your doctor might recommend, but knowing these, and feel free to take a screenshot or use the workbook to look at these and see if this is going to benefit you, and maybe asking your doctor. And if you do ask your doctor and they say no, then ask them why not, just as much as you would ask why it would benefit you. And we'll touch on that more next week in how to have those conversations.
So anytime there is a cognitive challenge, whether it's from a traumatic brain injury, whether it's from a stroke, whether it's from a developmental delay such as dyslexia, or if you've got multiple sclerosis, even epilepsy, if you've got cognitive challenges, you need to do a cognitive test to determine where those areas of cognitive decline are. Is it in long-term memory? Is it processing speed? Is it working memory, right? Or is it spatial awareness? And knowing that you need that data to really guide which therapy to go with. And again, I'll go back to this earlier example that I had. So in talking with this individual, I did not have the neurological reports yet. I didn't have the CT scans. We were just having a preliminary conversation. And she had had a traumatic brain injury, not a stroke. I think I said stroke earlier, but actually, this person I'm talking about was a traumatic brain injury. She fell, and oftentimes when you have a traumatic brain injury, and she had had a midline shift, you have a sensory integration issue. And so I was like, well, I think maybe you should go to the Mind Eye Institute, at least go talk to them. And then after I got the report back and looked at the levels of inflammation she was having, and the fact that she was not having any real balance issues from that, or she wasn't having any spatial awareness issues. She was able to continue to physically move well. I knew there wasn't a spatial awareness issue, which was my typical sort of assumption because of the midline shift. But after I reading that, and when I saw where the damage was in the brain and the levels of inflammation and a few other details on there, I was like, she does not need to go to see the Mind Eye Institute. Really, she needs to address this inflammation. That's top priority. So this is your key right here. Between the blood work and this neuropsych eval, you will have the data that you need to determine your first steps on that navigation and that pathway to recovery.
Yeah, and Sherry, could you mention too, getting a session or getting a session with you? We do recommend go through this four-part series to learn as much as you can and see what you can actually do yourselves. But then you can also book a session with you as well.
Yeah, you can. So we book two different types of sessions. One is a 30-minute, and that session is really designed to kind of walk you through the tools that we have, answer any questions, and sort of set you on the pathway yourself. So you've got a little bit of guided direction, give you a map. And then the second session is a blueprint session. We start out with a 1 hour conversation, and then we have multiple follow-ups. And that process is really to help you identify which therapies you should go and talk to your neurologist or your care team about, and really do some much more investigation. And another example, back to this other patient, I really did recommend some oxygen therapy. I thought that would tremendously benefit her because she had so much brain damage in there, but it just wasn't functioning well. The tissue was alive, but not functioning well. And so I thought the oxygen therapy would be a very good complement. But she had so much inflammation and swelling, right? She needed to go and talk about these therapies with her neurologist. And so that is really the point of the blueprint session, is to identify which therapies you should go and talk to your neurologist and care team about. We ask for a small donation on both of those because it does take so much time, especially the blueprint session. It typically takes me anywhere between 2 to 4 hours, depending on the situation, to really help someone with that process. So I think that answers the question.
Yes, it does.
Okay,
And then
good.
neurotesting for specific challenges, and these are, as you mentioned, depending on if they're having spatial awareness issues, um, right? That clock drawing test, which kind of comes back to the Barbara Arrowsmith that we watched last week and her story, and how she was saying like she was unable to draw a clock, right? And having that spatial awareness. So, Sherry, could you walk us through some of these as well?
Yeah, I would say the MOCA test here, this first one under memory and cognition, the Montreal Cognitive Assessment, that is by far, I would say, the top one that you should go and pursue. It will give you a very good overview of where your challenges are. And based on that, you might want to go and do some more detailed testing, but it is, I would say, probably the top one. This Wechsler Adult Intelligence Scale, that is a very comprehensive assessment. I think that's one you would do maybe after the MOCA or Barbara Arrowsmith's assessment. And you can find those online. You can do a MOCA test, a small MOCA test on for yourself. They have that on the Apollo Health website. There is a cognitive assessment there you can do for free as well. And I would say get started. See where your tests come out. Oh, and I did forget that the Livo 2. Sorry, I was trying to
Mhm.
remember the name of
Yeah.
the therapy that we had in our summit that we interviewed. He now has developed a free version of the CNS test, cognitive test, that you can have access to. There's a QR code in that presentation that is on our YouTube site. You can get and go do that for free. And it is a very um, good overview test to tell you, so, okay, I have issues with working memory. And then if you want to figure out what specific areas of working memory, then you're going to have to go do a more complex test that's going to take typically, I would say, about, anywhere from 3 to 8 hours, depending on what you have done. And these are just the different types of tests you can do depending on what your area is. And I've listed here to the left some of these screens that are you can go and do, like the CogniFit, the MOCA test. They're all online, and you can go do most of those for free. So just to get you started.
Perfect. Yeah, and so recognizing if you haven't done any of those free ones, as Sherry mentioned, the Mocha is one of the top ones recommended. And then looking within these three categories, where you're at, maybe if you haven't done any recently, maybe doing those tests and getting an update as well.
And I do recommend doing the MOCA test or the CNS test on a probably every 6 months, especially if you're going through different therapies, because you want to measure how effective they're being.
Yep, perfect. And then as we move into step three, now we're looking to determine the intervention potentials. And here we're going to be looking at different therapy types. There's a beautiful matrix that Sherry has created. And Sherry, do you want to go into that before or after your case study?
I think. Uh, the case study is with Clark Elliott.
Yes.
Yeah. I think let's go through it now, Izzy,
Okay.
please. And I think that'll make a little more sense and help us illustrate it. Yeah, thank you. So, should I pull that spreadsheet up then?
Yep, yep. If you could pull that
Okay.
up, I'll stop sharing and let you. And and we have a guide, and this will all again be in the portal where you can access this, and the guide will help explain what each one of these are.
Okay. So, Izzy, are you seeing the
Yes.
spreadsheet? Okay,
Yep.
great. All right. So, this is a very long and detailed spreadsheet. So, my goal with this and developing this spreadsheet is not to tell you, okay, here is the specific photobiomodulation technology that and provider that you want to go and find, because depending on where your geography is, what your specific situation is, and the fact that so many of these therapies can work for the same issue, right? You want to find what provider is in your geography, what their experience is with your specific situation, what your budget will allow. So it's flexible. And I think the flexibility is fantastic, but it can also be a little bit overwhelming when you're trying to figure out where do I go. So, and I think this is another reason why our follow-on sessions are very helpful, because this will get you pointed in the right direction. So, what we've done, I'm just going to explain how the spreadsheet works for you, and then you can go into this and figure out where you are and what challenges you have. So, we've broken down the therapies by the category. So, for example, if you're not willing to do some sort of invasive modulation, like a brain computer interface where nodules are inserted into your brain. If you want to try something before you go to that, right, you could look at the non-invasive types of therapies. If you've got, if cognition is your issue, or you've got some depression, or you've got vision related issues, you can just scroll down these and on in that manner and see, okay, what could be a fit with my specific challenges. And so we've just broken it out by different categories here to help you get started. And the other thing I want to show you here is this. Let me stop sharing and go to this document. What we've also done in this document is put together the therapy descriptions. So you will have that matrix and you can figure out where you fit on that matrix and what might be of value to you. And then you can come to the addendum that will be, this will all be in one document for you. And you can get a good description of what those are, each one of these. And so, for example, yeah, let's take acupuncture and dry needling, right? I can't put in here which acupuncturist you should go see, because there are a lot of qualified acupuncturists around in your area. Mirror therapy, similar. Those are you can find those in your geography. The same for e-stim type devices, or if you're going to look at vagal nerve stimulation, paired vagal nerve stimulation, you've got to find a doctor in your geography who knows how to do that. So this is a tool to help you narrow down where you should start your research. And I think that's the best way to think about it, and it gives you that information. Are there any questions on this at all? Because I do feel like it can be a little complicated. Okay, well, if you do have them, throw them in there. Feel free to reach out to me. Izzy will put this compiled the spreadsheet and this into
Mhm.
one document, and you'll have access to it. Izzy, anything you think I'm missing there from an explanation standpoint?
No, I think it's great. And if that is extremely confusing and you need help navigating it, right, then those sessions with Sherry will definitely help with that.
Okay, I think you have, yeah, you've got control.
Yeah.
Okay.
All right.
Okay, do you want me to do this, Izzy, the
Yeah,
case
that'd be great.
study?
And then you can walk us through. So, where that's going is Sherry's going to
Okay.
break down how that fits in with those charts.
So, Anusia, you put in the chat here, The Ghost in My Brain is a good book. It is. It's a phenomenal book. And the author of that book is Dr. Clark Elliott. He is an AI professor and had a traumatic brain injury. He was in a very small, slight car accident, quite frankly. It didn't do very much damage to his car. He was able to drive it home, had dented the bumper, but he was at a stop, a dead stop, and somebody hit him from behind. And over a week's time frame, maybe not even that long, he started to have significant lapses in balance. He had an inability to walk upright. He couldn't sleep with his eyes closed because of the severe nausea that it caused. He had to learn to sleep with his eyes open. He ended up having memory loss. He could not remember his children's name. That was one of the first things he did as he woke up every morning was try to recall who his children's were, what their names were, and their ages. He had an inability to transfer thoughts into action, so that motor skill loss. So he would walk to the refrigerator, he would be hungry, he'd walk to the refrigerator, but he could not cause his arm to reach out and grab the pineapple or whatever was in his refrigerator uh, and put it on a plate to eat. So he couldn't bend down and tie his shoe. He just could not on certain days recall how to do that. And he was a very highly motivated individual. Before this, he was a musician. He was a researcher. He taught, at the university, and now I'm forgetting which university in Chicago he taught at, but not Purdue. Starts with a P. Anyway, he was a very highly motivated individual, but he found he was having severe lack of motivation, just completely overwhelmed, did not want to engage. He withdrew before he had been a very social individual and sadness. So if you look at which of and I just updated the mapping system here, but he had motor. If you go back, Izzy, please. Oh, well, it's on here too. Yeah. So he had motor issues, sensory issues, cognitive issues, and emotional issues. So if you were trying to use this mapping tool that we have, you could look and see and say, okay, if you've got all four of these, where is my challenge? What therapies are going to try to get at all of those? And for him, his issue was really sensory integration, and that's what he describes in his book. That he found two different neuroplasticity therapies. One was addressing the sensory integration issue, his visual processing and his auditory processing were no longer aligned, which caused all of his spatial issues. And and that was the nausea, the dizziness, and then all of that caused so much anxiety. And he went through those therapies. That was the Mind Eye Institute, and then Designs for Strong Minds, which helped him address his attention and focus and lost cognition issues. So between the two of those, he now says he's more focused, he's more efficient and effective than he was even before the accident. And that's quite something for somebody who is an intellectual at heart. So this is the way in which you would use the tool that we've developed. And I want to mention here that it's really important for you to go back. This is kind of, I think, week one, where we were talking about mapping out your symptoms, knowing which ones are causing you the most difficulty, because your brain doesn't work in a linear fashion. And addressing one area may also create improvement in another area, but it may also not address that. So you do have to prioritize. And if you can get a therapy that addresses multiple at the same time, then, or two or therapies that work together to do that, then therein lies your magic pill, right? Your genie
Yeah.
bottle that you can work with.
I think that's
So
great.
step one, sorry, Izzy. Just make sure you know what your symptoms are. Step two, use that tool and description to do the research and try to figure out where you should focus your efforts. Step three, give those a try and then iterate the process.
Hmm. Yeah, and I think Barbara Aerosmith was a perfect example. And in the video we watched last week, she goes on to talk about how she noticed one area of her brain. She developed some exercises, got that area strong, and then went to the next area. And she did this with multiple areas of her brain. And just to shed light on that as that iterative process and what that would look like.
Yeah, her brain had quite a few different developmental issues that were not coordinated. One didn't affect the other. They didn't work in synergy. So she actually had to develop those new processes. And I think she ended up developing three or four individual ones for herself to be able to get to where she was at. And that is kind of the point about don't get frustrated, right? When you have an injury, when you have something like multiple sclerosis, which attacks different areas of your brain, or Parkinson's or a stroke that affects multiple areas of the brain, you will likely have to try multiple therapies and interventions to get you where you need to go.
Yep. All right, so just summarizing here, looking at your data, your personal information, your testing, all of the information that you've gathered so far, making sure that it's up to date, and looking at those therapy categories and having the access to that. Note what questions you have as you look at these things. If we are not able to answer them, it's great questions to take to your doctor. And as you map out a plan and look at this, you are going to need to go through these and map your plan out to take it to your doctor, because sometimes they're not aware of these. Maybe it's not top of mind for them to recommend. And so being your own advocate in that way. And then understanding how to look at the research, know what you can read, what you can't read, know where to get help.
Yeah, and just to reiterate that, none of the physicians that are practicing or graduated from med school in the last, maybe the last 5 years, anyone before that never heard of the word of neuroplasticity. They were not educated. It was not part of their curriculum. And so you'll have to create it and approach it as a partnership. So don't go to it as this is alternative. This is the future. This is what's happening. This is where all the innovation is. And I know I've mentioned it before, but brain care is approaching a complete paradigm shift. We are going through what happened with heart and cardio care, 25 years ago. So this is what's happening. And it is, it's a joint effort to get everyone up to speed, and your doctor will thank you. If he's a great doctor or she's a great doctor, they will thank you for bringing this to their attention so that they can help others.
Yes. All right, moving on to Q&A. So if you have any questions, put those in the chat. My contact information is here if you have any questions. And
Any questions? We've got about maybe, well, I think we're supposed to end at 7:30, so we're right on time, but we're happy to take a question if there's something personal you'd like to answer, if there's a therapy you want any information on, is if there's how do you get into the portal, any questions like that.
yes, yeah. And while you're thinking about those questions, we do have our next book club is Good Anxiety. My book just came in the mail this morning and I've started reading. So we'll be discussing that. And so how we've been doing it is we've released the book of what we're going to be reading, and then we take the time to read it and then have the discussion on the first Tuesday of each month. And it's a live discussion on Zoom. If you are in Louisville, we're going to be having a live in-person book study. We'll be meeting every other week. So that's going to be fun as well.
Yeah, and to that point, we we are doing one book a month. If you want to share feedback that you love that broken down further, please do. We're open to how we do that format.
Mhm.
So please do let us know. You do not have to read the book to enjoy the conversation. We structure it in a way that we give you the points. and walk through those. So you can get the essence of the book by joining us, even if you haven't read the book.
Yes. And we will be sending out a survey soon to see what that best format for you is. And then how to engage. Of course, we always love when people want to donate and share resources with us. And then we have those one-on-one discussions, as we've mentioned with Sherry. You can check out resources on our website. There's continuing to be added more and more resources, including our upcoming podcast where we'll be interviewing professionals as well. And then volunteering as we're continuing to get the word out and sharing the message of neuroplasticity and the new advancements.
Yeah, and let us know what you would like to see from us. We've been working on developing our programs. We're putting together the content that we think will help you the most. But if you feel like there's something that's missing, please do let us know. We would love to hear from you.
Yes,
And I
indeed.
guess we have a question here from Dell. What's the website? It's NP Ally. So NPALLIES.org. I'll drop it in the chat right now. There.
I just pulled it back. I was trying to grab my
Thanks.
charger so my computer doesn't die. um, but yes, and feel free. Again, if you have any suggestions or questions, you can email me, and we will get those answered for you to the best of our ability.
Oh, and I'm sorry, Barbara, I see your question here. What's Del B? Oh, Dale Bredesen's website. So it's Apollo Health, APOLLO Health. Let me get this for you real quick. I'll put it in the chat. Yeah, the Apollo Health and Dale Bredesen's work is he's been focused on reversing Alzheimer's. He's just completed 6 clinical trials that prove it is reversible and 6 times more effective than anything that is even remotely out there on the market that's available. And
Mhm.
not only is he showing tremendous value for Alzheimer's, it's for other neurodegenerative diseases as well, especially Parkinson's. He's shown, got a lot of great research there. And some for multiple sclerosis. I would say the majority of the work has been on Parkinson's.
Yeah,
So check him out.
I was talking to a friend recently, and she was saying in Canada, many for the MS movement there, they're using his diet to help quite a bit.
Yeah, and if you know Terry Walls, if you've got multiple sclerosis or anyone who does, her diet is phenomenal. Her story is phenomenal. We need to do a case study on her, Izzy. Let's make note of that because she's remarkable. It does follow very closely to what it's the Keto Flex diet
Mhm.
that Bredesen recommends. David Perlmutter is also another one who's done a lot of research there.
Perfect.
And then I will thank you for putting this book back up, Izzy. I will say, of all the book club books I have read, this book is for everyone. Right, regardless of whether you're trying to just recover, which has been a lot of our focus and conversation around the books that we've discussed. This book is for every single person, and reframing the mindset for how you look and use anxiety. It's making a huge impact on me, and so I really encourage you to read it. It's not very technical. It's one you can listen to if that's your preferred method as well.
Perfect. All right. Well, thank you all for joining us, and we look forward to seeing you next week for session 4, our last session of this series.
Okay, great. We'll see you next week. Oh, and Izzy, what are we going to talk about next week before we go? We're going to walk through. So go through these go through the workbooks if you're interested, look at those, and we are going to walk through and your individual situations. We're going to help you develop a path for yourself. So it's an action oriented session. We're going to talk a little bit about self advocacy, a little bit about longevity as well, but really the majority of that conversation is going to be helping you chart your own path using the tools that we've developed and kind of walking you through them and uh, doing breakouts, and so it'll be a live interactive session.
Perfect. All right. Thank you all.
Okay, bye bye, everyone.
Bye.